Am I being impatient? Yes. Am I being frustrated? Increasingly so. Am I angry? Well, I'm definitely angrier. But why? Welcome to Arm Wrestling with COVID-19 in London. This is number 13. When I decided last night to record and upload and publish this latest short reflection, I merely wanted to say another thank you, to clap in my own way to all those care workers across the 4 nations who are helping us during this predicament we are all facing together. I wanted to acknowledge the work of the NHS, not only the frontline staff, not only the doctors, the medics, the critical nurses or the nurses, but also the porters, also the cleaners, everybody who is working in all our hospitals. I also wanted to say thank you to the post office staff, to those in supermarkets, to those in pharmacies and chemist shops, to those driving buses and trains, to those emptying our bins once or twice a week, to everybody who is doing their best to try and help us cope with what is, at the very least, unusual circumstances. However, as I sat in front of my screen this morning, I changed my mind. I said, yes, I'm going to acknowledge all those care workers who do so much service to the nation because they deserve it. And incidentally, they deserve more than just a clap every Thursday evening. They deserve more than just being described as a badge of honor. They need to be safe. They need to be protected. But I'm not going to stop there because I've done this before already. I'm going to also talk for a couple of minutes about my impatience, my frustration, and even my anger. Why? I asked. Well, if you heard Dr. Jenny Harris, the medical advisor for the government, say that the UK is an exemplar of preparedness for COVID-19, honestly, the mind boggles. Are we on the same planet? Are we inhabiting the same space? When I read articles like the one in the Sunday Times, which was a scathing article about how the government was remiss in its duty, how it did not realize the gravity of the situation as far back as January and February. When further to that, I read in the medical Lancet magazine an indictment, that's how I would describe it, of the efforts by government to try and cope with a very difficult situation. Admittedly, it is very difficult. I'm not saying that our government is failing while everybody else is succeeding. Far be it from that. I'm not even comparing us with Germany and Singapore or Korea. What I'm saying is that we blustered our way through this crisis at the beginning, and then when we realized how bad it was and we started initiating all those tactical moves, not strategic moves, tactical moves, then we are paying a price. And what is the price we're paying? All those deaths we're hearing about in the care homes, where the staff are doing a wonderful job, in the hospitals, in GP practices, everywhere where people are dying, literally dying, because we did not act soon enough to provide them with their PPE, to provide them with the medication they need in ICU, whether that is the antibiotic, antiviral agent, whether that is the ventilator, whether that is the supply of oxygen, whether that is even those relaxant medications that would help with intubation. We were basically trying to resolve each crisis as it came, not being ahead of the crisis as leadership would require. And that is why I'm impatient. That is why I'm frustrated. That is why I'm angry. And I'm not alone. I bet you I'm not alone. I don't go around polling people. I don't go around asking people whether they're angry or not. Different people express themselves in different ways. And we in the United Kingdom, one thing I love about this country is its phlegmatic, cool temperament in times of crisis. However, all that being equal, we have to realize that there is a problem. And to say that we are an exemplar of preparedness just basically rubs me the wrong way. And I feel that I would have to come and say a few things. But why, you might ask? Okay, Harry says a few things. Big deal. Why does Harry say a few things? Anybody could say it. Yes, anybody could say it. But let me tell you one thing. When ministers who are briefing us every evening or who are being interviewed on radio, when they bluster, when they stonewall, when they spin, and when they don't answer the question, you tell them, what about ventilators? They start talking about what a good job they've been doing. They always come back and say, if push comes to shove, okay, once we're through this crisis, whether in weeks, in months, or even longer, then we will discuss what went wrong. We will examine our actions. We will even have a public inquiry. But let me say this thing. I'm a middle-aged man. I have underlying problems. I've been in this country for almost 3 decades, happily, by choice, not by necessity. And what good does it do me to talk about hindsight and to talk about a public inquiry 2-3 years down the road if I get the virus, if I get terribly sick, and if I die? I don't want to die. I don't think any of you want to die. And when I think that I might die because there isn't a ventilator, because there isn't enough oxygen, because we haven't thought strategically, but we're doing tactical games, I get impatient, I get frustrated, I get angry. And I bet you, so do many Brits across the 4 nations, cool and phlegmatic as we are. So as I wish you again a safe few days ahead, let me also wish you abundant life.